trusting that you're seeing what you're supposed to see. I'm going to talk today about the welfare state in the global data markets, trying to benefit from the vast data depositories, records, and registries. I'm going to discuss two metaphors, goldmine and well-oiled machine, to illustrate the ideas, reasonings, and expectations about data as a commodity that a welfare state could sell. The first metaphor, goldmine, refers to vast amounts of data collected by the state that are now seen to offer new kind of potential outside the original primary uses. And the latter one, the well-oiled machine, is used to refer to Finland as an environment that is lucrative for international investors and collaborators, that the access to these data, the regulation, and what is increasingly termed as health data ecosystem works seamlessly, efficiently, and fluently like a well-oiled machine. So in the end of this talk, I will address some questions that rise when states participate in global data markets and imagine themselves as platforms. And all in all, I need to underline at this point that this presentation builds heavily on the collaboration that I have done together with Karoliina Snell and Aaro Tupasela at the University of Helsinki. So this is really based on our joint work. And here a bit more in detail what I will go through in this presentation. I will first tell a bit about data collecting and welfare state data depositories in Finland and in the Nordic countries, as it is the case that much of what I say applies more widely in other Nordic countries too. I will then present the idea of population branding. That is one conceptual tool through which to look at this topic. From there, I will move on to present the first metaphor, the data as goldmine. And then I will present two currently coexisting data regimes of health and social data that reveal the key tensions between primary and secondary uses of health data. That is that in Finland, there is on the one hand, the welfare state data regime and the regime of data-driven health economy. And these two have very different relation to the state collected data and to the citizens. And from there, I will then move on to discuss and describe the second metaphor of this well-oiled machine. And then, as said, then finally there will be the time to discuss a bit the questions that rise from this whole endeavor. And after that, we will have our joint discussion. First few words about the national data collections of Finland. Finland is one of the Nordic welfare states where state-collected statistics and registers have been an integral part of healthcare governance and intervention for decades. The establishment of data gathering practices, registers, and infrastructures happened together with the construction of welfare state institutions in the 1960s and in the 1970s, particularly. And these practices have a strong link to the establishment of universal public healthcare and social services. And this link has meant that the data collection has then been widely accepted by the public as well. And since decades, the state and public authorities have collected data on a broad range of human activity. There are hospital records, there are cadastral registries dating back to centuries. There are cancer registries, records on employment, diagnoses, medical prescriptions, child welfare, family relations, abortions, mass screenings, and various other things that are recorded. The logic of this data accumulation lies in it being automated, systematic, and all-encompassing. Everyone is inscribed in the records through the personal identification numbers, and the administrators are obliged to collect data. These different records and registries and the personal identification numbers that identify everyone individually are crucial for the everyday life. Many entitlements and services are based on them. So the connection to what you receive as a citizen and your rights are quite clear. And because of the personal identification number is used across domains, the various different records and registries in the country can be linked together. This allows to track and follow whole lifespans, employment histories, and like you name it, what you want to follow. And this has been a feature that has allowed, for example, epidemiological studies, and the register data has been widely used previously for research already. However, now there is an expectation that all this data should be used more efficiently and even more widely. The primary purposes the data has been collected for are not considered sort of enough anymore. And this idea of further uses has been intensifying, especially during the past decade, as if the data collections would be underused, underutilized, and inefficient if they were used solely for what they were collected for, such as unemployment reimbursements, needs of governance, healthcare provision, and so on. So during the past decade, then, there have been regulatory and organizational renewals and proposals that aim to enable and foster wider uses of this data. And this data is now seen as a resource and raw material. And the picture here in the right I have attached illustrates the efforts making data available. And you can see there, for example, the wording permissive legislation, for example, and this is one of the phrases that is used in the marketing of Finland as a place to be for biomedical research and development. And this picture is by a consulting company, so it is made to generate interest, and it is there for selling. And I particularly like the point that there is the inhabitants there. In this slide there are 5.5 million, and in the next slide it's suddenly 5.6, even though this is made by the same company. But anyway, let's move on to this one. The angle of marketing and advertising and generating interest. So when data is a resource to sell and something that could be used to generate new services, applications, benefits, and economic activity, it can be approached, for example, through this conceptual lens of population branding. And the concept addresses the marketing of these kinds of data resources and sees data as a product that needs its own characteristics to be appealing and distinctive. When data becomes product, the people of whom the data is collected become sort of living resources for the state. And this resource can then be marketed as a specific kind of product, which is in this case advertised here in this picture on the right by the same consulting company. The idea of population branding comes obviously close to nation branding, even though population branding specifically is more connected to these national scientific practices and national data resources, as well as other national characteristics such as education, national happiness, competition indexes, and so on. For example, Finns are often advertised as being a willing population, the population who wants to participate in these things and does not say no to research participation and so on. According to Tupasela, who has developed this concept, population branding operates in two ways. It aims to target external audiences, such as research collaborators and foreign investors, by constructing a particular image and identity of the nation and its resources. But it simultaneously reinforces already existing national narratives of identity and capacity. One way to brand these population data resources and welfare state collected data has been the fact that they've been called gold mines. The idea of welfare states having data called gold mines and the utilization of this metaphor in the marketing have been taking place through the past decade. Here I have a picture of the cover of a report that describes the Nordic registers and biobanks as gold mines for health and welfare research. The report was prepared by a working group under Nordforsk, an organization under Nordic Council of Ministers. The metaphor of gold mine points to wealth, obviously, and as a metaphor, it is, as Lakoff and Johnson have put it, about understanding and experiencing one kind of a thing in terms of another. Metaphors such as gold mine have been said also to be about establishing links between different things that then shape our thinking and can be utilized in communication. The idea of gold mine communicates the understanding that there is something valuable to mine. There is raw material waiting for being used. And of course, a gold mine should be utilized rather than left as is if one wants success and wealth. It is a promise that there is something valuable there. And this gold mine is of course, as I said already, about branding, as it targets specific audiences and constructs a particular image of national resources. On the one hand, it points to this existence of data resources in the first place, but it also has become a popular reference point in almost all recent policy papers found in the Nordic countries relating to data. The Nordic registers and data are seen as unique, but simultaneously the use of this metaphor shows how big data has become a major political and economic preoccupation, and new investments and innovations are expected. Thus, a reference to gold mine embodies the idea that existing data depositories, registers, and records can become a highly profitable commodity. And just as an example of this gold mine, one of the key features that gets advertised is often the completeness of the data, that when it is collected within universal healthcare service, it is said to cover the inhabitants from cradle to grave and to be socio-economically non-biased. So then, as one example of these gold mines, in Finland, in the National Electronic Archive of patient records alone, I'm saying there were because now it has already grown. There were 2,742,402,445 files on the 31st of January this year. And Finns are only a nation of 5 million people at the moment. So despite the visions and efforts to commodify state collected data and utilize this gold mine, there are tensions as well. One can easily ask in which ways health data can be exploited and used in commercial markets without undermining people's trust in the public services, and often specifically to the healthcare service and system. And in a way, we discussed this tension in our recent article, in which we identified two health data regimes that coexist in Finland. The welfare state data regime points to the data collection for the purposes of governance and administration, as well as statistics and so on. It is precisely the kind of everyday operation that has allowed the gold mine to form. And this regime gains its legitimacy from the benefits and services people receive. There is inherent reciprocity. However, the latter one, the regime of data-driven health economy, is about the appropriation of population data and about the generative activities that are expected to follow from the opening of this data for new and multiple purposes. The possible benefits of this regime point to the idea that prosperity will follow from increased economic activity and investments. In the simultaneous presence of these both data regimes, the state is at the same time producer, provider, and consumer of the data. The state tries to sell and make money based on data collected primarily for welfare state related services and administration. So the state has a dual role. It wants to be a beneficiary of big data, but then it should also be aware of the potential danger of accumulation of big data and act as intermediary gatekeeper for citizens. So it tries to exploit national data, but should simultaneously be able to act in the interest of citizens and their rights and sort of the primary purposes of the data. And for example, the GDPR and the privacy of people are in constant unease with the idea of secondary use of health data and also social care data. And unlike companies who collect data on their customers, state collected data is based on citizenship and residence. So obviously it is opposed to a customer relationship. And for example, the universal healthcare system has been built on ethos of fairness and equality. And these are principles that do not necessarily match with market forces and competition in data markets. And as I said previously, the data collecting by the public sector is done as part of the daily operation. And it is done according to the legal mandate to maintain population registers and records. So they are constantly updated and growing. And for citizen, there is no possibility to opt out, since the records and registers are such central part of the functioning of the whole system and living in these societies. But in data-driven health economy, this data from population serves as a resource for extractive industries too. And in our article, we argue that the simultaneous logics of the welfare state and data-driven health economy create a paradox, that being part of the data economy is dependent on welfare state practices, where the legitimacy of data collecting and use rests on reciprocal virtuous circles between the state and the citizens. But the logic of data-driven health economy then dismantles this existing base, since data extraction is focused on the generation of private profit. And this contradicts the justification of the welfare state data gathering, since a promise of profit itself is not necessarily enough to justify the uses of citizens' personal health data as a resource for economic activity outside data's original primary context. Or at least there are issues on the acceptability and trustworthiness of this endeavor that should be openly discussed. And those who benefit from the widening uses of health data might indeed be the citizens, but this would happen then through economic growth and market mechanisms instead of the more direct manner associated with the welfare state data regime and public services. And this all might contrast with the way people have used to think about the healthcare and data gathered through public services. So there is sort of a lot at stake in terms of acceptability here. And then we move on what the successful data-driven health economy then seems to require in terms of organization and regulation. For the health data ecosystem, the goldmine of data is not enough. And there is, I would say, also sort of a temporal difference in these, that of the gold mines, there has been talk about them at least 15 years or more. But this well-oiled machine and ecosystem stuff has risen in the past years, and so it's a latter. Let's say that it's a latter discourse, or if we use those terms. So the goldmine of data is not enough for the health data ecosystem, because the goldmine is just a resource, as you can see also in this picture, in the bottom part of the picture I have here. This picture is from a PowerPoint show by an innovation officer who presented under the title Finland, Most Advanced Ecosystem for Healthcare Innovation. So what has to be in place for the expectations to come true is a functioning environment, an ecosystem of health data, or as I heard it described last autumn, Finland has to be an environment that works like well-oiled machine. This metaphor was used both by a government official and a prominent researcher who were both speakers at a health ecosystem event. Both speakers were underlining the goal of Finland to be a place that is internationally known for its efficacy and seamless service, easy access, clear regulations, and so on. These all were characteristics that were believed to serve as a competitive advantage and be meaningful for the collaborators. And for Finland to be this well-oiled machine in data markets, several reconfigurations and reorientations have already taken place during the past 10 years. And more work is still needed, according to these speakers who used the machine metaphor. So what has already been done are, for example, the regulatory changes. In 2012, a Biobank Act was passed, which defined the biobanking in Finland and how, like what biobanking in Finland is defined by this law, and how biobanks should operate. This is also defined by the law. And this law allowed to draw together previous scattered research collections, as well as sample collections of clinical hospitals. And also the collecting of new prospective samples started. The law also covered the health data that can be attached to the samples. And it was soon discovered that this health data generated a lot of interest, even without the interest on the samples. And I guess this interest was also sort of in the background, giving rise to the effort to make and draw together this law on secondary uses of health and social data that was then passed in 2019. And for making Finnish social and healthcare data available for secondary uses, a new permit authority called FinData was founded in 2020. And FinData is an authority giving the permits and access to these data and pulling them together from various different sources. And the picture here is a few years old, and it portrays the idea of FinData a bit before its founding. As it says there, data permit authority and service will be established, and now it is already established and operating. The single point of contact, as one can see in the picture as well, has been a very important idea in making this well-oiled machine to come true. The idea that there has to be seamlessness, single point of contact, a streamlined service for the potential customer. So Finland has to be a service provider where everything is smoothly packaged. Otherwise, the customers will go elsewhere. And so it's not enough to have the gold mine. For the sole existence of big data means also complexity. For example, the Finnish health and social care information system architecture has about 400 to 800 systems that need to be integrated for this full-scale utilization of Finnish data to actually become reality. So skill in data management becomes an important feature of this machinery too. And alongside the founding of FinData, renewal of Biobank Act and drafting a law on genome center and storage of genome data have both been in process, but they are still in process. So both have not realized yet the new version, neither the new version of Biobank Act or the genome law. But what this tells is that there has been a continuous reorganization of these resources throughout the decade, and sort of internal competition as well in terms of who will be in charge of resources and from which resources. At one point it seemed that it will be the biobank storing the genome data, but then suddenly this idea of genome center popped up that there will be a specific place for it. So there is sort of internal competition as well on these resources. And what these different actors in charge of resources and trying to find collaborators and customers share is the idea of this single point of contact, or as it is referred as well, a one-stop shop. The Finnish biobanks, for example, realized that having 10 biobanks means being too scattered. So they should have this one-stop shop too for their customers. And for this, they founded a biobank co-op to serve as a single point of contact for biobanks in Finland. And this cooperation nowadays hosts a portal called FinGenius as a gateway to the samples. So the idea of one-stop shop is elementary for well-oiled machine. And in this way, both FinData and Biobank Co-op are examples of the general understanding that centralization and national coordination is needed in making Finland accessible and successful in data markets. Both the Biobank Cooperative and the FinData are often seen in connection with the idea of national health data ecosystem. And this ecosystem is an example of how the infrastructure of the country, the local regulation, the data processing and data management capacity are portrayed in the context of marketing and business reasonings and in building a certain brand. And for example, the so-called enabling regulation of Finland is part of these efforts to allow resources flow easily, which is believed in resulting economic activity. The ecosystem would ideally allow platform kind of model where connections between everyone participating are formed and sustained, and generative activities associated with platforms would follow. And as you probably have thought about in when I was talking through this slide, that this slide was actually filled with metaphors that could be looked at analytically, not only the well-oiled machine, but you could actually also analyze this one-stop shop or single point of contact or ecosystem as such, or even the enabling regulation. They all have like their own interesting characteristics. So I don't know if I have been running and rushing through my presentation, but I'm coming towards the end of it, to my last slide. In our articles on this topic, we have argued, as I said previously, that the logic of data-driven health economy does not fit seamlessly with the welfare state data regime, since the welfare state data regime is beyond economic wealth generation or idea of making profit, whereas data-driven health economy is very much about the potential for economic wealth and private profit. It is an ill fit with the way data gathering by the state has been justified before through benefits and rights that are actualized through the register keeping. And now the primary context is only one of the many potential contexts, and it is difficult for an individual to keep track of this multiplicity. And in general, the rights and obligations become unclear when data becomes a commodity. For example, the issue of data ownership is very different in the context of data as commodity or data as part of universal healthcare system. And in the welfare state model, the basic reciprocities between the citizen and the state are related to services and reimbursements that are offered through public institutions. And in the health data economy context, this is not the case anymore. So why should the citizen approve and accept that the healthcare provider collects the health data also for other purposes than their healthcare? Do they have an ethical responsibility as citizens to contribute for this potential good that follows from sharing and opening data for new purposes? Are they suddenly sort of paying for those services by participating in the data generation? With private companies such as Google, customers have, at least in principle, and perhaps only in principle, freedom to choose their service provider, and they exchange their data with the service. But with the state, you are not a customer in the same sense, and your entitlements are based on citizenship and not in exchange relationship with a company that aims to make profit. And moreover, in Finland, the participation in the generation of national data is not something an individual can actually choose whether one wants to do it or not. As we remember, the data is both collected and made available on legal basis. There are no consents, nor are there systems where one could track all the ways in which publicly collected data is used. It is actually presented often that the data gathering and utilization for multiple purposes is just business as usual, that the registers have existed for many decades, and hospital records, for example, have been used for research before, as if the secondary uses are about are sort of similar thing as the register studies and part of contributing to a common welfare state project. So the focus on past in this business as usual reasoning as a justification for data gathering and use downplays the recent changes in the context, the possibilities to combine, analyze, and distribute data in novel ways for both public and commercial interests inside and outside the nation state. And simultaneously, the public-private collaborations appear to be the way private partners seek access to these data. In these collaborations, the trust towards public partners seem to legitimate the data uses or products being developed. Thus, it is clear that the scope and justifications of the data uses are now changing. A similar contextual change has taken place elsewhere too. For example, in Britain, the NHS seeks to have their patients widely as research patients too, and there is the European-wide health data space being prepared and other such openings as well. But in Finland, at least, it has been discussed less whether this change of context to commercial and innovations, public-private partnerships, and business will have an effect on how data collecting is accepted among citizens. Especially vulnerable, this data collecting for multiple purposes becomes if there are no transparency or oversight about the way health data is used and how the benefits are distributed. And there is more to come. In the most thorough data visions that now kind of expand wider than just health data, the whole data structure throughout the public and private sectors are envisioned as interconnected. The platform economy visions of the future, which can be seen in the Finnish policy reports on the topic, envision how, and now I quote, by connecting automatically, for instance, data about the amount of personal social relationships produced by social media, GP's data about the body mass index and family history regarding health, income data based on the income registry, and data about the food consumption based on data collected by the grocery store, health problems can be predicted and prevented, end of quote. In this government report on the future from 2018, the real-time production and collection of data is leading to a real-time proactivity and recognition of where interventions are needed. There is less discussion in this report about, for example, GDPR. In another platform economy report, there is an outspoken view that companies, ministries, hospital districts, and universities should all be developed from now on as information exchanging networks. This is all seen to improve productivity and generating eventually customer value, as this goes to assumption, what results from platforms. Even though these are still future visions on the pages of reports, one can still ask if this platform nation state indeed is the kind of world we are heading to, and if it is, what are the things we should be aware of and think through. And I think this is where I will end my presentation, and here is are the key references of the text and articles that I used in crafting this together.